Dr. Treacy. Welcome.
Well, thank you, and thank you for having me. When Dr. Nahal was speaking earlier about the use of the applications in medicine, and went back 100 years, and then we also had the use of the ultrasonic techniques for doing blepharoplasties. It reminded me, I used to lecture for Elman, and I suppose the original Elman devices were invented by Irving Elman in New York many years ago. He was a dentist. His wife Shirley was the lady who marketed his whole techniques. But I only mention it because this is something also that goes back 100 years. It's been involved in medicine a long, long time. It's like one of these things almost from a Wild West show, because it'll not only work in stretch marks, it'll work in cellulite, it'll grow hair, it'll remove fat, it'll remove scars. It is just one of those things that when it was introduced to me originally, I was very, very skeptical. It was one of those, I suppose, machines that I let my nurses start playing with more than myself. And it's really taken off in Europe now to the extent that we have this type of marketing in a lot of the magazines, and pump up the volume with this new device. And it's been marketed also in a lot of the British newspapers as the new Botox. So what is it, and how does it work? This here is also, believe it or not, where it can be used for infraorbital fat panels, for high pigmentation in the infraorbital area, for vascularity, and it seems to have an edge in everything. As I say, it's something that goes back a long, long time, and certainly touching into the sort of beginning of the last century. What it involves is just injecting carbon dioxide gas into the skin with a 30 gauge needle, and you turn around and say, how in God's name could something like that be effective across such a wide plethora of cosmetic medicine and surgery? The way that it seems to work is that if you introduce carbon dioxide into an area by the application of hypercapnic stimuli, it induces neocollagenesis and neovascularization, because the skin is fooled into thinking that there isn't enough oxygen, so it responds by a process of neoangioma, and as a consequence of that, or angiogenesis, sorry, as a consequence of that, it will bring not only sort of oxygen but collagen in the air. We'll run through this. This is Robert Boyle, who was originally involved also with the use of carbon dioxide and oxygen. He's the father of chemistry, as you know. And the first use, I just did a little run through the sort of medical journals. The first use we can see of it was back in the 1930s, when doctors found that if they injected CO2 into the skin, along with CO2 that's present in sort of the warm baths, that they got rid of some vascular ischemic symptoms because of a vasodilatory effect. And it's apparent also that they were doing this for Raynaud's disease back in the 1930s. It went from France, from what I can see, to Italy, and somebody started using it with venous ulcers with quite dramatic effects. And we all know that patients who come into the hospitals to the nurses with those gross venous ulcers, they go necrotic. We expect that if we get oxygen to the area to improve it, but they knew back almost 90 years ago that if you give oxygen to the area, you actually make it worse, and dramatically worse. And the Italians used this principle back to front and tried carbon dioxide and discovered that they started to get better. Now, I flipped through this quickly. I know I'm going to get to stretch marks, but because it's used across the board, these are the different publications within it. The use of this method in sort of aesthetic medicine is only really a recent phenomenon, and there was only 2 or 3 papers that I could come across, again from Italy originally, where they showed that it could be used for reducing fat, and I can go into that later if required. And also, there's a 2008 paper in Brazil where they showed that induction of carbon dioxide insufflation rather, can induce new collagen. How does it work? It works on a number of different levels. The first thing, as we mentioned, is vasodilation, and the induction of carbon dioxide injections has a very strong vasodilatory effect, increases blood flow. The second thing is the Bohr effect, and that is where you have got increased carbon dioxide within the skin. This will have a tendency to cause the hemoglobin to have a great affinity for oxygen, and it also will release oxygen then later back into the tissues at a higher rate. This is called the Bohr effect. I'll skip through this as well. The Brazilian study had showed that you not only get initially neovascularization, but then also neocollagenesis, and this is demonstrative through numerous pathological slides that we have. Now, I'm just showing you, because this is what impressed me originally, its use in diabetic ulcers by the Italians. It almost seems that they were sitting on this technology for almost 30 years before somebody decided to see would it work in aesthetic medicine. So these are slides of the technique being used in conventional medicine rather than aesthetic medicine. And we also know that not only does it improve wound healing, but also scars. And there's quite a lot of work that's been done, particularly on patients who've had previous mastectomies that have had quite substantial sort of hypertrophic and even keloid scars, where a lot of these scars have almost disappeared. The cosmetic indications, which I thought this was originally, and I discovered it was on stretch marks per se, do cross the board in fat and cellulite. I certainly have had a lot of experience within stretch marks, and I can get to that. The stretch marks normally we treat the patients once a week. We run it at a rate of about 80 cc per minute, that's 1 to 2 cc's per kilogram per minute, and it causes a little blister underneath the skin. And whenever the stretch marks, which have become, quite white over a period of years, are beginning to treat it, they take back the colour of the skin, which is amazing. And we think that this is an effect that CO2 is having on melanin itself. And normally we would do 1 session per month for a period of 5 or 6 sessions. We've done it more often, certainly. Now that we've been up and running, we're doing it about every 3 weeks. And I've been 25 years in medicine and surgery, and certainly 15 years in aesthetic medicine. It's the first time I've ever seen anything I can put a hand on my heart and say it actually removes stretch marks. With this technique also, it doesn't tend to be very painful. We can use a local anaesthetic, topical. The nurses tend to favour using a strong one that I use for laser resurfacing, which is 23%, but certainly most people don't need anything at all. Whenever you're doing it around the eyes, it can be a little painful. And we do a lot of laser liposuction, and a lot of our patients present to us, obviously, after gestation with a lot of loose skin, and we find this is a wonderful adjunct for patients that we know that post-laser liposuction they're going to have loose skin, and we can offer this as a treatment. We used to use radiofrequency, which was a bit, I suppose, iffy to an extent. We have an Accent and a Polaris, which is similar in its original one before the E-prime. And the results we have been getting in a lot of patients are very complementary compared to, I suppose, what has been out there to this point. It's funny, last week I was down at this place in Ireland with a friend, and I just happened to be taking photographs, and I discovered that Robert Boyle was actually born there back in 1627. And sheer coincidence, the fact that I was coming to Las Vegas to get a lecture which included him. In terms of the other uses of the technique, it's very useful in the periorbital area, and particularly patients who would have had loose skin that would require blepharoplasties, patients who would have infraorbital fat pads. And we find that normally the flow rates we use here are much less, usually 20 to 40 cc's per minute. And the patient normally require 2 to 4 treatments, maybe 5. We have done quite a series, I suppose, of Asian patients who have had almost cloismic effects underneath their eyes, but not so much cloismic, but certainly hyperpigmentation per se. Maybe a little melasma looking, and these patients have been getting quite good results as well. In terms of other uses of the technique, I should mention there, when we're doing eyes, you have to purge out the system first, because if you get oxygen in air around the eyes, it can cause quite an inflammatory effect that can last for a few days. It's really quite dramatic when you're doing eyes, because the skin pops out around the eyeball almost like a frog's eye, and that lasts for 2 or 3 minutes, and quite shocking to the patient first. I wouldn't show them a mirror, but once they've done it 2 or 3 times, they sort of tend to laugh at it themselves, because they know that it passes off quite easily. In terms of cellulite, it certainly seems to have a role as well, because we have a lot of different methods for treating cellulite, such as the Bellsmith radio frequency and a couple of other things. We don't tend to use it as much, but anecdotal evidence that I've seen, because our machine was down for a period of nearly a month trying to get ahead for it, some of the patients switched over to this technique. It certainly seems to work there as well, across all the sort of methods of cellulites, grade 1 to grade 4. And also, we've been using it in acne scarring. I've been using it in acne necrotica of a patient's head, because we also do hair transplantation, and a patient who had severe, I suppose, alopecia, secondary to sort of acne scarring on the scalp for a period of 10 years, and we've been able to successfully do a hair transplant on that patient, and we stopped the technique, and the hair has continued to grow, which was one of my concerns, that if we got his scalp suitable for doing hair transplantation, as soon as we would stop doing the CO2, whether the whole hair would fall out again, but so far so good. How long have I left? Oh, just a minute. In terms of contraindications, from what I can see, most of the contraindications that seem to be highlighted are mostly the same as people have used for mesotherapy. I don't tend to be a great favourite with mesotherapy. I have nothing against it. It's just, I suppose, I have so many other techniques that are in my armoury. I tend to be quite practical, but I see that a lot of the similar techniques or contraindications they have for this seem to be the ones that they have transplanted across for mesotherapy. It's such a safe technique. I haven't seen too many things that certainly would pose as problems. I suppose pregnancy would always be something from a legal point of view we have to be careful of. Anticoagulation, skin infections. Some of these I'm not even sure if I agree with, because I certainly treated patients with skin infections quite successfully, including that patient earlier that I mentioned that we did the hair transplantation on, and patients with acne scarring as well. Thank you.
Thank you so much. Fascinating. do we have any questions? Nothing working? All right. Well, thank you so much for sharing your experience with us, and I want to thank the audience and the other speakers in this session for really a wonderful interactive session. I wish you a